Kansas State University, located in the heart of the Little Apple, Manhattan, Kansas, is home to more than 20,000 students. But did you know that 1 in 4 of them are affected by seasonal affective disorder? Stay with us to learn more about SAD and how students can cope with its effects. Seasonal affective disorder is a type of depression that happens during certain times of the year, usually in the fall and winter when there's less sunlight. It can make people feel tired, sad, or less interested in things they usually enjoy. Dr. Jennifer Smith, a professor in the psychology department, is an expert in this field.
Seasonal affective disorder is interesting because it has a lot of the same symptomology as major depression. So you're going to feel down or sad. You might have a loss of interest in your normal activities, a change in weight either up or down over a pretty fast period of time. You'll have some sleep issues, either sleeping more or sleeping less or interrupted sleep. Additionally, you'll feel fatigued or tired kind of all day. So it's really hard to get up in the morning. And when you're awake, you just don't feel like your brain is completely on. You might feel additionally like an abnormal sense of guilt or responsibility for things that aren't getting done, which kind of weighs in your mind, which is something that people don't really recognize as being a symptom. You might not be able to concentrate very well. And additionally, many people have what they call suicidal ideation. And you have to have at least 5 of those symptoms, and I listed about 10, but you have to have at least 5 of those for a period of 2 weeks or longer to really show up as being potentially depressive symptoms.
SAD most often starts during late teens to early adulthood. Many K-State students manage it by spending time outdoors in the sun and making use of the support resources available on campus.
So I think, you can do a lot of things that you can do outside indoors, but the difference is just that, the sunlight is so beneficial when it comes to doing those things outside. You can't disregard having a good tan whenever you go outside and do something. It just makes me feel good. It's also just nice to be outside and enjoy nature as you're walking around and stuff. I think it's something we take a lot of the times for granted.
During the winter months, getting that perfect tan isn't really an option. As a result, students often look for other ways to stay active and engaged.
In the colder months when I'm not really able to go outside as much because I'm not a fan of the cold, I spend a lot of time studying in the library or just inside my apartment, and it just gives me a little more anxiety about school and stress because I feel like I'm enclosed, get a little claustrophobic inside, and just looking at the same thing all the time. It's not awesome.
If you're a K-State student experiencing signs of seasonal affective disorder and want someone to talk to, consider reaching out to CAPS at Lafine Health Center. Their licensed therapists provide a supportive and comfortable environment to help you navigate whatever you are going through.
So for students who are feeling any symptoms of seasonal affective disorders or any depression disorders, we strongly recommend that they speak with one of our counselors over at our counseling psychological services here at Lafine. You don't have to make an appointment. You simply walk in, fill out a form, and a counselor will sit and review the form with you, and they will let you know which of their services would be best suited for you.
Seasonal affective disorder is more common than you might think, but help is available. Whether it's talking to someone or finding small ways to brighten your day, taking the first step can make a big difference.